Hello, I'm Cheryl Hawkins. Welcome to Solutions, the series that highlights the incredible work that nonprofits do every day to solve problems in our communities. On this edition of Solutions, we're focusing on the work of Primary Care Coalition, a unique organization that serves as a safety net to make sure underrepresented individuals get the health care they need and deserve. Here's a look at the work they do.
Healthcare is more than just the delivery of healthcare services. So if we want to begin to move the pendulum on health outcomes in the community, we need to begin to focus on overall wellness.
Montgomery County is unique in the way that the population is very diverse. So paying attention to disparity and minority population is critical.
So we have language issues, transportation issues, lack of family support, or families that are present but might not have the resources themselves to be as helpful as possible to their loved one. So it's important to try to find resources and services to assist our residents in overcoming these barriers. Primary Care Coalition has a focus on developing and supporting safety net medical care resources for underserved populations.
PCC is very valuable to us because it provides us a lot of flexibility. It is an organization that works with very open-minded, very willing to listen, and health disparity is not something that we can do in a routine basis. To eliminate health disparity will require creativity.
And they try to ensure that they're the highest quality, that best practices are instilled in them, and they are a collaborator. So they bring all of these stakeholders together, whether it's hospitals, the county government, the different nonprofits, and the clinics together to ensure that people have access to quality health care.
Well, they have extensive knowledge of resources within the county and a real understanding of the special needs of underserved populations. So they bring that to the table. In addition to that, they understand the different pieces of a puzzle, the research component to identify how we can demonstrate the effectiveness of the program, what the specific needs are, so that they're able to put all the pieces of the puzzle together and to make a program possible.
I would say PCC has done many great things for the county. They have built up the reputation, including the county council, including the county government. It's a well-known nonprofit organization that would help build the trust. And I think many organizations, they also look forward to this kind of partnership with PCC to work together.
And now joining me in studio is Leslie Graham, President and Chief Executive Officer of Primary Care Coalition. Leslie, welcome to Solutions.
Thank you, Cheryl. Great to be here.
Great to have you here. So I want to start by you telling me a little bit about Primary Care Coalition, also known as PCC.
Yes.
Who founded it and who do you serve?
So PCC, a nonprofit, was founded here in Montgomery County in 1993 by a group of concerned physicians who saw that there were people who had no access to health care, or they didn't know how to use, say they were immigrants who didn't know how to use the U.S. healthcare system, or English was not their first language, or they were uninsured, or they didn't have, they were low income and couldn't pay copays. And so together with the Montgomery County Medical Society, Primary Care Coalition was founded to ensure that every resident of Montgomery County, regardless of their economic stature, could have access to high quality care right here in Montgomery County.
Great, so you're a coalition. Does your organization actually provide medical care?
We are not a direct service provider ourselves. We are what's called a backbone organization. And so no, we don't provide direct services ourselves. We organize services and we work by building partnerships and strengthening the systems that we have.
So you say a backbone. Tell me, what does that mean?
Sure. A backbone organization. Right. So that means that we build coalitions, we build partnerships, we take things that no single organization could do well on their own or as well on their own, and we create partnerships so that you can do more together. So we bring together really largely direct service organizations who are busy doing all of their direct service, but we could make so much more of an impact for county residents if we bring them together and form networks across a single sector or bring different sectors together to learn how to work better together. So that's what we do. We organize funding, we organize advocacy, we organize data. We're very data driven. We do quality review, clinical quality review to make sure that any of the providers that are in our networks are providing high quality care to the people who are served.
You said you organize the data, you gather data. You're getting that data from the providers?
We have so many different programs, but yes, for some of our programs that are about serving real Montgomery County residents, direct services, then yes, we collect data on that to ensure that the programs that we're running are high quality. For instance, there are national metrics out there that say, if you have a population that you as a provider are serving, you should be able to keep a certain percentage of that, a high percentage of that patient population with their diabetes within control, or their hypertension within control, or everybody should get a depression screening at least once a year. So we make sure all those national metrics that have been decided by physicians groups are being adhered to, and that the populations are
I
getting
got one
that.
more question about that
Sure.
data, because that's a lot of information you're collecting.
Yep.
And so do you use it to help determine what care needs to be provided? Do you present that data to the Montgomery County government to help them to also decide how funds should be?
Yeah,
decided?
so both of those. So first of all, we present it to the government so that they can see the value, the return on investment that they're getting for the subsidies that they provide for these programs. But we also use it with the providers, because one of the things we do as a backbone organization is we're experts in quality improvement. So we help providers figure out if they're not meeting a national benchmark, how do we help them get there?
Great. So tell me a little bit about you. How did you get to PCC? Have you always worked in the nonprofit sector?
No, the first half of my career was in the for-profit sector. I worked most of my career the first half of my career for for-profit, largely in healthcare consulting. So I worked internationally with ministries of health around the world. I spent about 7 years living in the Middle East, helping improve healthcare systems there. And then I went and I ran some direct service clinics as well around Maryland. So that was, then I switched into the nonprofit sector. Yeah.
What did you bring from the corporate world?
What did I bring?
Yeah, I mean, they're basically a business or organization is an organization. You got the same kind of things you need to operate, but were there other things that you learned in the career on the for-profit side that helped the nonprofit side?
Absolutely. I think a lot of nonprofits are sort of like, you start small, you might start in somebody's basement or a church or something like that, and then you grow. Every nonprofit sort of starts small and grows. And often if you have people who've only come from nonprofit, they don't necessarily have had the experiences to be able to bring in sort of that business sense of how do you manage the financials and what are your key drivers. And so it's really important to be able to do that, because a nonprofit, like any company, has to be able to pay its bills. Yes. We have to run like a business, but we are not out to provide any return to shareholders or owners. Everything that we create, we put right back into programs.
So tell me, how do your programs actually serve the residents of Montgomery County?
Yeah, so we have two types of programs in Primary Care Coalition, or PCC. One of them is healthcare access programs, which are really about making sure that low income or otherwise underserved Montgomery County residents can have access to high quality care. So that's our healthcare access programs. And then we have programs around population health, which are more around developing systems between different providers on the continuum of care, or creating programs that help healthcare systems in general improve. So on the healthcare access one, because that is about direct service, though we don't provide the direct service ourselves, we are the ones who are sort of organizing. We've created a network. So we have two big programs that we run. One is called Montgomery Cares and one is called Care for Kids. They are subsidized by Montgomery County government and implemented by a range of providers, everything from, there's a large group of about 12 nonprofit safety net providers in Montgomery County. There are 6 hospitals in Montgomery County. There are private providers in Montgomery County who participate. So we organize all of that. And so these two programs, Care for Kids and Montgomery Cares, are for residents of Montgomery County whose families are under 250% of the federal poverty level, and they don't otherwise have health insurance, and they need access to care. And so we organize these programs, and people can go to children and adults, any age, once they're in these programs, can go to one of our contracted providers, get primary care, behavioral health care, which is integrated right with primary care. They can get generic and name brand medicines, and then they can be referred for specialty care. And we even have some access to dental care as well.
Nice. So can these people that you're serving stay on with the programs? Is it just for a period of time, or can they stay there as long as they need?
Yeah, so as long as a Montgomery County resident meets the eligibility criteria, they can stay with the program as long as they're meeting the criteria. So with the Care for Kids program, that's for children from birth to age 18. As soon as they turn 19, they have to leave the program, but through their 18th year. For adults, it's anybody 18 and older who meets the eligibility criteria. For Montgomery Cares, they do have to be redetermined for eligibility annually. And with Care for Kids, it's every 2 years.
Great. So you have several partnerships that PCC works with. What organizations do you partner with, and what do you look for in another organization that would make them a good candidate for a partnership with PCC?
Yeah, that's a really interesting question. It's less about what do we look for in the other organizations, it's what can we all do together. So for us, the reason we exist, PCC, as an organization that creates collaboratives, is because we truly believe that 1 + 1 can equal more than 2, and that we all improve when we learn together and learn from each other. And so what we look for is organizations that hold those same values and those same beliefs, because then when we come together, even if we're not in the same sector, food sector, medical sector, housing sector, legal aid, etc., when we come together, we shine and we create better systems in this county to serve the residents. And so that's what we look for, is how we can do things better together. If it's something that a partner is doing as an individual organization and they're doing it great, they don't need to be in a collaborative.
Right.
But there are so many places where things fall between the cracks, or there are gaps. And so we've learned over our 30 years as being PCC is that the benefit of being a backbone organization is that direct service organizations are so busy delivering direct service as they're supposed to, and as they do well. And people have wonderful, innovative ideas for what would be, we could do this better, or we could serve more people. But the day-to-day drives out the ability to really think those things through. So PCC supporting, bringing together collaboratives to think about what we can do better, and then providing the backbone to make those ideas really come to reality, that is a wonderful thing for our county.
Really, it is.
Yeah.
So you all PCC has a storytelling show program. What is that? Tell me a little bit
I
about
love
it.
our storytelling show. So that's our annual event. It's sort of a fundraiser, a chance for people to come and learn about PCC and what we and all of the partners do. And when I say partners, as I said, that's anything from medical clinics to hospitals to the county government to food providers, et cetera, to the police, to fire and rescue, the school system, other nonprofits. So in the storytelling show, every year we have 6 people, just ordinary people like you and me, who stand on stage, just them and a mic, telling their own personal story, their raw experience of why they do the work they do as related to sort of what PCC and all of our partners do together. And it is powerful. It is just wonderful to hear those stories and to, and connect with these people just like us who are telling how they got to where they were in a really meaningful way. And it's full of emotion, and often, full of humor. We all look back on our lives and we can find humor in it. So it's a great night. We love it.
So in closing out, do you have a success story that you could share that touches your heart?
Yeah, one of the things I think about that speaks to us as a collaborative organization, one of them is, of course, this network of providers that has been built over the years to provide healthcare access. I just want to say this network of providers is terrific, and we serve over 35,000 Montgomery County residents every year, adults and children, through these networks of Care for Kids and Montgomery Cares. But the other one I want to share that's an example is the collaborative that we helped to found about 4 years ago now, the Behavioral Health Crisis Collaborative. So there was the state was offering out grant money, and so we brought together police, fire and rescue, the hospitals, the Department of Health to talk about how people who are experiencing a behavioral health crisis in this county, what their options are, how are they served. And really, largely if somebody is having a breakdown to the point where they're a danger to themselves or others, the police pick them up and they might end up in jail, or fire and rescue picks them up and they end up at a hospital emergency department. And those might not be the right things for people. And so everybody came together, brainstormed ideas. There were some national best practices out there, and PCC wrote a grant to the state for money. It wasn't awarded, actually. We didn't get the money, but everybody loved the idea and was so committed to what we thought we could make as a difference in this county that for the last 4 years, all the partners have been working together, and we have made such a change. We've gone from 16 crisis beds in this county to 40. We have the Department of Health and Human Services has mobile crisis outreach teams. They have greatly expanded the number of those teams. Those teams, which always had to go out before with a police officer, now 30% of them don't need a police officer, so it can be a faster response and perhaps a better response to the person there. And I could just go on, but that's the kind of thing that we do in a collaborative like that, and it changes the lives of people in our county. And I love it.
That's wonderful, because that's what a nonprofit should be doing, helping to change the lives of people in the community that they serve. Leslie, thank you so much for being here on Solutions, and thank you for the wonderful work you're doing. It's very important.
Thank you for having us on.
Yes.
Thanks.
We're going to take a short break, and when we come back, I'll be joined by Mindy Pierce, Senior Director, Nexus Montgomery and Population Health Programs. Stay with us. We'll be right back. Welcome back. I'm Cheryl Hawkins. You're watching Solutions, the series that highlights the great work that nonprofits do in our communities. On this episode, we are focusing on the work of Primary Care Coalition in Montgomery County. And on this segment, I'm joined by Mindy Pierce, Senior Director, Nexus Montgomery and Population Health Programs with Primary Care Coalition. Mindy, welcome to Solutions.
Cheryl, hi, thank you.
Thank you for being here. I want to start by you telling me a little bit about you. What was your path to coming to PCC?
Sure. I've been in the health and wellness industry for my entire career, from working with organizations to improve the health of their employees, all the way to commercial health clubs and in through hospitals. I obtained my MBA in healthcare because when I started working in with the hospitals, I really knew that there were opportunities for us to connect in to the community and work with other organizations to improve the health of the community. So I joined Primary Care Coalition with that experience and have enjoyed being here for a little over 3.5 years.
Well, that's awesome. It's really great when a nonprofit can get an MBA for them, help manage a lot of, it's a business, and nonprofits need that.
It's interesting to be able to have the healthcare aspect of it, because healthcare has a different business line and business model than many other places, and especially in Maryland, it's different from almost every other state. So being able to understand it from an operational perspective and apply it into programs helps us really try to connect with the organizations we're serving and then connect in with the individuals as well.
That's awesome. So tell me, what is population health?
Population health is really a collaboration of businesses, organizations with a focus on a particular population. It could be the senior population, it could be a minority population, it could be any number of organizations or multiple that come together with a single focus in improving the health of that population.
And so tell me a little bit about the special program you have for the Asian American and Pacific Islander communities. Would that come under?
It does come under population health. We work with Montgomery County Department of Health and Human Services, the Asian American Health Initiative. PCC has partnered with them for many years to be able to help improve the health of the Asian American Pacific Islander communities. It's very, very specific. There are a lot of needs that are very specific to that population. And so we work to be able to help fund some organizations through the county and then help them with capacity building and programming, health and wellness, behavioral health, and work through what's called a Healthy Communities Fund, where organizations can apply for funding to improve the health of their communities, which again is population health.
Yeah, that's great to hear, because America is a pot, we're full of all kinds of people and cultures, and to see that, I don't usually see organizations that target this population, so I was glad to see that.
The diversity in Montgomery County is one of our best qualities that we have here. And the way that we can work in with our populations here, understand them, be deep into the communities, help impact them from specific needs that each community has, that's where we really look to be able to make our impact.
So PCC has a partnership with local hospitals called Nexus Montgomery. Tell me about that partnership. What do you do?
Yes, so about in 2016, the 6 hospitals of Montgomery County came together to form a regional partnership called Nexus Montgomery Regional Partnership, working together to do what one hospital cannot do alone, and we say that they are better together. Primary Care Coalition acts as the managing entity for Nexus Montgomery. So Nexus Montgomery really does have PCC embedded in the work that we do across working through all of the any programs that exist with Nexus Montgomery, where they're working with skilled nursing facilities, helping that people don't return back to the hospitals after being discharged from care, helping people with behavioral health needs, so outside of the hospital, so they don't need to go to the emergency departments to think that that's where they need their care. Or if they're discharged for a number of different reasons, we're able to get them to the appropriate care in the community by building these partnerships and being able to help do some quality improvement across our partnerships as well.
So how does that actually work? You get information from the hospitals on the people that have come to them through this program, and then you're able to monitor them that way?
Yes, as Leslie was talking, we do have a number of different data sources. So we have aggregate data. We are very data driven. We really look at what impacts are needed. So we want to make the data driven decisions that impact all of the hospitals. That when they have those common threads of need, that's when we're able to help design things, to be able to help in process improvement, in capacity building. In a number of places, one of our programs being our workforce capacity building program, because of the healthcare workforce having some challenges. Nexus Montgomery has PCC leading the efforts to be able to help build the pipeline of new healthcare workers. That's one example of how we can help all hospitals together.
Great. So talk a little bit more about the workforce development program. Who benefits from that, and who's Yeah. How do you
So as we always partner with organizations, we have a number of community-based organizations that we partner with, and we help them with their communities. We look to get culturally and linguistically diverse community members who have maybe never thought about having a healthcare career enter into Montgomery College for a certified nursing assistant program or a certificate entry-level healthcare program that is a very short term, but much needed position in all of our hospitals and our healthcare settings overall in Montgomery County. So we help provide them with the opportunity to apply into Montgomery College. We help them with scholarships. We are externally funded by a number of different sources to be able to help provide these scholarships to Montgomery College and then help them with career readiness and other wraparound services. They're able to take care of their families, take care of their health, and then also obtain employment in healthcare and help our healthcare workforce as well.
That's awesome. You do a lot.
We do.
Can you share a success story out of all of this that
Sure.
you provide to people?
We recently attended one of the graduations of the Certified Nursing Assistant program, and there was an individual that was, she was surrounded by her family, and this was a multi-generational family that was so proud of her. It was her kids, her parents, her brothers and sisters, and to see into the multi-generational impact that one workforce addition can make onto it, we knew we were making a great impact from there, and that's one of hundreds of stories.
Wow, I know you have lots. Mindy, thank you so much
you.
for being with us on Solutions. Thank you for what you do.
Thank
I can tell you enjoy doing it, and that's important.
Thank you very much. It is very important.
Yes, again, I'd like to thank Leslie Graham, President and Chief Executive Officer, and Mindy Pierce, Senior Director, Nexus Montgomery and Population Health Programs with Primary Care Coalition, for being my guests on this episode of Solutions. If you'd like more information about Primary Care Coalition, you can visit their website at primarycarecoalition.org, or you can call them at 301-628-3405. I'm Cheryl Hawkins. Thank you for watching, and I'll see you next time for more Solutions.